Welcome to the Endocrine Matters podcast. This podcast episode is sponsored by Complete Medicine and Hey Healthy. Welcome back to Endocrine Matters. I'm Arti Thangudu, and today we're diving into one of the biggest developments in metabolic and obesity medicine we've seen in years. The sweeping changes in GLP-1 medication pricing and what those changes truly mean for patients, clinicians, and our deeply flawed healthcare system. If you or someone you love has tried to access medications like Zepbound or Wegovy, you already know the struggle. Soaring prices, restrictive insurance rules, confusing formularies, shortages, and a system that puts obstacles everywhere a patient turns. But today we're seeing a shift. Prices are coming down. Access is widening. Political pressure is reshaping the landscape, finally. And while that's worth celebrating, it's also worth scrutinizing because what's happening behind the scenes is just as important as what's happening at the pharmacy counter. Just this week, we are recording this episode on November 19th, 2025, Novo Nordisk announced a sweeping reduction in prices for all doses of Ozempic. So today, we'll unpack the economics, the politics, the patient impact, the risks, and the opportunities of this moment. We'll talk about why transparent pricing matters and why safe, expert prescribing matters. Let's jump in. So what just happened? A clear, simple, and breakdown is what we have for you. Recently, Eli Lilly and Novo Nordisk struck agreements with the Trump administration that significantly reduced the cost of GLP-1 medications for millions of people. Here's the big picture of what has been proposed so far. With Medicare and Medicaid, obesity and comorbidities like prediabetes or heart failure, people will now have access to these medications with the total plan price plus patient out-of-pocket cost around $245 per month. Medicare patients will have a $50 per month copay, so that's $50 out of pocket. Cash pay prices direct from the manufacturer will be around $299 per month for Zepbound via Lilly Direct. That's what we have so far. For semaglutide or Ozempic and Wegovy, prices will range from $199 to $499 per month based on the doses. These are drugs that previously carried a list price of over $1,000 a month. So while these prices are still high, they're a huge move in the right direction. But why are the pharmaceutical companies even doing this? Well, in return, the companies receive a 3-year grace period from new tariffs, fast track review for their upcoming oral GLP-1 pills. There is a huge pipeline on medications in this class and category and for obesity on the horizon. And they'll also have expanded Medicare access to people. More people will be using these medications. They look like the hero. They get political goodwill, and their positioning is way better for future regulatory battles. So yes, patients get a lower price. That is a win. Pharma gets meaningful benefits in return, though. It's a negotiated moment, not necessarily a philanthropic one, but the outcome does matter. Real people will finally have access to medications they've needed for years. So what does this mean for patients, particularly next year? This shift means older adults with obesity and metabolic disease, people who are at the highest risk of heart attack, stroke, kidney disease, disability, and death, will finally gain access to therapies that meaningfully improve longevity and quality of life and health span. It also means fewer people will have to ration doses, which means skipping months of therapy, splitting pens, and fewer people will have to rely on unreliable online sellers. And for patients who are not on Medicare, the cash price options are still a major improvement. $199 or $499 is not cheap, but it is dramatically more feasible than more than $1,000 per month. This price drop does raise some really important questions. If pharma companies can suddenly charge $199 or $299 instead of $1,200, what changed? What changed so suddenly, and why now? That leads us to the next layer. Transparent pricing, is that a hero move or is it a strategic move? Let's talk honestly about transparent cash pricing. The public sees it as a win, which it is, but it also happens to be extremely profitable for pharmaceutical companies. When they sell directly to patients, they bypass PBMs or pharmacy benefit managers. That means they keep more of the revenue. They also control the distribution and the conversations that they're having with the public, the people who are actually consuming these medications. They control the messaging around these medications, and they look like the hero. And honestly, I'm okay holding two truths at once. Transparent pricing helps patients, and transparent pricing helps pharma profits. Both can be true. Now, here's the critical addition. Prices are still high, but transparency changes everything. Even at $199 or $499, these medications are still expensive. Let's not sugarcoat it, but for the first time, we have clear pricing. We have predictable pricing. We have publicly available pricing. We have pricing that can be compared. This pricing invites competition, and competition is what will ultimately bring prices down. You cannot have price competition when every PBM is manipulating formulary placement, rebate structures, and list prices in the dark. Transparent cash pricing breaks that cycle. My hope is that as more companies release GLP-1 therapies, injectables, and oral versions, we'll see a natural downward pressure on prices. That's what happens in functioning markets. And this is the first time the GLP-1 market has looked anything close to functional. And this might finally discourage compounded GLP-1 use. Compounded GLP-1s are unregulated, inconsistent, they're not tested for stability, their effectiveness is not studied in large trials like the branded versions. They're not tested for true concentration of the medications. They are not subject to FDA standards, and they are often far more expensive than people realize. Patients have turned to them because branded medications were unaffordable or unavailable. But now with direct from manufacturer options at $199 to $499, patients have a safer, more reliable, and still relatively affordable alternative. My hope is that this shift pulls patients away from unsafe compounded versions and toward medications with proven efficacy, predictable dosing, and real oversight. Patients deserve affordability and safety. They should never have to choose between the two. We don't prescribe compounded semaglutide or tirzepatide for a simple reason. There's no safety or efficacy data on these compounds. There are available options where that data is available, and not a single compounding pharmacy that has approached me is tracking data. None of them can provide consistent source information or purity information that I find reliable enough to prescribe. We do, however, find the best pricing available and use expert-level dosing techniques that also reduce our patients' spend while still getting them safe and effective results. Now, let's correct a massive misconception. GLP-1 medications are not cosmetic injectables. They treat type 2 diabetes, prediabetes, metabolic syndrome, fatty liver disease. They can help patients with PCOS, cardiovascular disease, inflammation, insulin resistance. They reduce all-cause mortality, so death. They reduce heart attacks and strokes. They improve quality of life in ways weight loss alone cannot explain. So increasing access is not about aesthetics. It's about preventing the complications that destroy lives and break families. Another amazing thing to me is that the GLP-1 revolution exposed the racket of our healthcare system. The public finally saw the inner workings of drug pricing. Suddenly, it became obvious that list prices were inflated, PBMs were profiting, rebates distorted everything, insurers block access for financial reasons for their own financial gain, and patients have been stuck with the bill. The fact that a drug can go from $1,200 to $299 or $199 without changing manufacturing costs should tell you everything you need to know. The GLP-1 explosion forced the system to reveal itself, and once people see the game, they don't unsee it. This attention is good. This pressure is necessary, and meaningful change often starts with public scrutiny. More access is good, but safe prescribing matters more than ever now that these medications will be more accessible. Now, we must confront the other half of this story. With greater access comes greater misuse. 5 years ago, severe GLP-1 side effects were uncommon because endocrinologists and obesity specialists were the primary prescribers. Like, more than 90% of these meds were written by us. We started low, we titrated slowly, we screened for risks, we monitored labs, we counseled our patients, we managed expectations, we treated the root cause of their diseases. Now, with viral social media trends, med spas, and unsupervised telehealth platforms, patients are experiencing extreme nausea, dehydration, severe GI complications, muscle loss, gallbladder issues, malnutrition, medication interactions, inappropriate dosing. When prescribers treat these meds like trendy weight loss hacks instead of metabolic therapies, patients get hurt. Access without expertise is dangerous. Patients need clinicians who understand endocrinology, obesity medicine, pharmacology, nutritional needs, metabolic physiology. This is not a plug-and-play medication. It is a powerful therapeutic tool that must be used responsibly. So, what has the effect of social media been? Social media did two things simultaneously. It destigmatized obesity treatment, a win, and it also trivialized obesity treatment. Patients have been told, just take the shot. It's effortless. You don't need a follow-up. Get it from the spa. This messaging created unrealistic expectations and unsafe practices. GLP-1 safety depends on expertise, not virality. Now let's talk about why Pharma made this deal now. Let's zoom out. Pharma agreed to lower prices in exchange for tariff relief, expedited pathways for GLP-1 pills, expanded Medicare coverage, political goodwill, regulatory protection. This is strategic, this is business, and this is timing. But the truth is, if strategic moves lead to increased access for patients, that's still progress. We can remain clear-eyed about incentives and acknowledge the benefits. So what does this moment mean for the future? Here's the big picture. Lower prices mean more patients treated. Transparency means competition and ultimately lower costs. Reduced dependence on PBMs is a step towards sanity in this space. Oral GLPs are coming, which should shift the market again. Safe prescribing must remain a priority. We must protect patients from misinformation and unsafe alternatives. And you as a patient, if you're listening, you need to be aware of this too and advocate for yourself. This moment has enormous potential if we guide it responsibly. So, our final takeaways for patients, here's what I want every listener to leave with. 1, you deserve access to these medications. They are legitimate, evidence-based therapies. 2, lower prices are a step in the right direction, not the finish line. 3, transparent pricing opens the door to actual competition, and competition is what drives prices down. 4, please avoid compounded GLP-1s when safe, regulated, proven alternatives exist. Your safety matters more than short-term cost. 5, work with a clinician who understands these medications deeply. Your health and safety depend on it. Thank you for joining me for this important conversation. The landscape is shifting quickly, and if we stay informed, stay compassionate, and keep patients at the center of every decision, we can shape a future where metabolic healthcare is safer, more equitable, and more accessible. I'm Dr. Arti Thangudu. This is Endocrine Matters, and as always, your health matters, your voice matters, and I'm grateful you're here. If you'd like to see me in clinic or learn more, visit essaycomplete.com and follow me on Instagram and YouTube at Dr. Arti Thangudu.